We've now come to the sponsor perspective portion of our program. Please welcome to the stage Deborah Melito, President of the American Society of Consultant Pharmacists, in conversation with Joe Ruffalo, General Manager of The Hill.
The role of pharmacists in nursing homes and assisted living is unique. Pharmacists are empowered to assist the medical team in making sure medications are safe and effective, particularly for older adults who are more sensitive to medication changes and drugs in general. Can you talk about your role as a long-term care pharmacist in caring for patients and supporting their health goals?
Yeah, sure. So when we go into our nursing home facilities, as the senior care consultant pharmacists, we like to be part of the healthcare team. So we work very closely with the medical directors, the directors of nursing, the nursing home administrators, the infection preventionists, to name a few. And you know, when we're part of that team, we are the drug experts, and we can really assist in that arena, looking at falls assessments, weight loss. We can look at different medications that may be contributing. And we also are very involved in the antibiotic stewardship programs at our nursing homes. I actually follow the CDC core elements for an effective antibiotic stewardship program, and it's a great educational tool that we utilize at a lot of our facilities. We also are very involved with all of the psychoactive medications that our residents may be on, specifically antipsychotics. And with the American Society of Consultant Pharmacists, we are very involved in Project Pause. We are actually talking with CMS about revisiting the way antipsychotics are listed, you know, for each facility and how it affects their quality metrics and their star ratings. And then in line with today's topic, we really look at the CDC Advisory Committee of Immunization Practices, or ASCP, all of their guidelines for immunizations, making sure that we're giving the correct information at all times on the vaccines that our residents need.
So the responsibility to vaccinate was new to pharmacists in long-term care during the pandemic. Pharmacists actually provided over 80% of the vaccines in nursing home and achieved vaccine rates of over 90%. Since the pandemic, the rollback of flexibilities has hurt the rates of vaccinations. What can policymakers do to improve this going forward?
Yes, when we had those flexibilities through the PrEP Act, we were able, as a long-term care pharmacy, to order the vaccines, to store the vaccines, to distribute the vaccines, to administer the vaccines, and to bill for the vaccines. And that was very difficult to do when the vaccines first came out. I'm actually the vaccine coordinator for my pharmacy, and I found that it was one of the most difficult things I've done in my pharmacy career. However, when I was able to go into my nursing homes and actually immunize frail females in their beds, and they would look up at me and say, "Now my daughter can come visit me," that became I was so grateful for being able to do that. So we would really like to see those flexibilities reinstituted. It was the HHS secretary who let those flexibilities expire. So we would really like to see them reinstituted.
So the ECAPS legislation would empower pharmacists to test and treat for infectious diseases. How will this authority reduce the impact of outbreaks in facilities and save more lives in older adults?
So the ECAPS bill, HR 1770, I don't remember a lot of House bill numbers, but I remember that one. That actually could give pharmacists provider status, which is something that we've been trying to do for 50 years. It's in the Social Securities Act where pharmacists have to be added as providers. So here's what happened during the pandemic. We were able to not only administer the vaccines and bill for them, but then we were given prescriptive authority to order nirmatrelvir or ritonavir, which is Paxlovid. So if a community member came into a community pharmacy, or like at my long-term care pharmacy, we would get orders from the nursing home where the doctors would say, "We need you to determine if this resident is a candidate for Paxlovid." And so, because I said earlier we're medication experts, we were able to evaluate the drug-drug interactions that can occur with Paxlovid, and we also had access to labs, such as the kidney or renal function, and specifically for Paxlovid, it's GFR. So if a resident needed to, tested positive for COVID, we would get the order to dose Paxlovid. So it would either be the standard dose Paxlovid, or if the GFR was lower, we would give the renal dose Paxlovid. Or in some cases, we would have to say, this resident is not a candidate for Paxlovid. Maybe we could try molnupiravir or Lagavria. So all things with COVID were not bad. We were given that prescriptive authority. And we would like to see that continue in House Bill 1770, in that we would be given the authority to test, treat, and immunize against 4 infectious diseases, namely flu, COVID, RSV, and strep.
Great. Is there anything else you think our audience should know today, based on what you've heard this morning?
So I liked what the congressman had to say. It sounded very positive, and if that bill would pass this week, that would be fantastic. I'm actually the president of ASCP, and I said maybe during my presidential year we will become providers. I just think that we're in line for something like that. Like it's the right time. We proved ourselves during the pandemic. We had the highest percentage of immunizations in the seniors of anyone else. We were upwards of 80% and higher. And so when we were able to go in like on a consulting day and also immunize, it saved the nurses so much time. And we know that the staffing at nursing homes is not good right now. And so anything we can do to help the nurses, they really appreciate it. So having those flexibilities reinstituted where it can be a seamless process would be wonderful.
That's great. Well, thank you so much for your insights today, and thank you for what you do.
Thank you.